More women are dying of pregnancy complications. A new study finds a 40% increase in maternal mortality in America, the highest level in nearly 60 years. And a woman's race plays a role. I talk with a doctor to find out what's going wrong and what can be done to make it better.
We have very large issues with access to prenatal care in this country.
The U.S. now holds the #1 spot in a ranking no one wants to top. Maternal mortality hits the highest level since 1965, the highest among high-income countries. The new data from the Centers for Disease Control and Prevention show the U.S. maternal death rate rose sharply in 2021, and experts worry the problem is getting worse.
I have lots of women in my practice that are over the age of 40, and that increases your risk of maternal mortality significantly.
Maternal mortality for women over 40 is 7 times higher than women under 25. High blood pressure, cardiovascular disease, and diabetes also increase risk.
The biggest concern is access to care.
The maternal mortality rates among Black women are more than twice as high as those of white women.
The interesting thing is it doesn't matter how educated they are, how wealthy they are, where they live, the rate is still higher, even if everything else is even. So we know that there are definitely some biases that people have, healthcare providers have towards Black women.
You may remember superstar tennis player Serena Williams describing her near-death experience after giving birth to her daughter. Although the hospital staff didn't seem overly concerned, she insisted on getting tests that ultimately revealed she needed urgent surgery to keep potentially deadly blood clots from reaching her lungs.
We have to be aggressive with it. We have to recognize that there is a problem, recognize that there are a lot of biases that we have.
Dr. Overby says a diverse panel of doctors and providers is important. She also wants patients to speak up if they feel uncomfortable or have someone you trust be at your side.
During labor and delivery, there are studies that say that having a doula, which is a pregnancy support person, you have better outcomes.
You can read the full CDC study for yourself. Also, we have additional information on our website, abc10.com.